So if I told you that some of the most precise biomechanical engineering in the world today is happening inside women's underwear,
Oh boy.
right? And using nothing but bamboo fleece and like hyaluronic acid, you'd probably be pretty
Well, I
confused.
mean, I would be. Yeah.
Because we don't usually associate intimate wellness with, aerospace level physics. We picture innovation as microchips or things made of titanium and glass
Mm.
built in these sterile labs.
Right. It definitely runs counter to our usual image of what technology looks like.
Yeah.
For generations, the standard of care for female intimate discomfort was essentially just a culture of silence.
Wow. Yeah.
Women were just expected to, simply endure changes to their bodies,
Right.
whether that was from childbirth or aging or hormonal shifts.
Deal with it.
Exactly. It was this taboo burden of womanhood, which meant the tools available were incredibly rudimentary for a very long time.
And that silence is exactly what makes today's source stack so compelling. We are exploring a massive collection of materials today that cover women's intimate comfort, hygiene, and wellness. And I have to say, the contrast within these documents is wild.
It's quite a spectrum.
It really is. Because on one hand, we have these incredibly earnest, boutique, eco-friendly, period brand blogs.
Right.
Like companies with names like Lil Helper or Party in My Pants and Amy Pads.
Alongside highly technical U.S. patent filings, just filled with physics equations,
Yeah.
which are then cross-referenced with clinical FAQs from, high-end urology and plastic surgery centers. We are really spanning the gap between Etsy craft sellers
Yeah.
and Beverly Hills medical clinics here.
It is a fascinating spectrum. So our mission for this deep dive is to demystify two completely different, yet remarkably similarly named, solutions that women are using right now to take control of their intimate health.
Right, the cloth and the clinical.
No, exactly. We are looking at the reusable cloth interlabial pad and the medical labial puff procedure. So, okay, let's unpack this, starting with the cloth side of things.
Which I think serves as a brilliant entry point because it really bridges the gap between everyday hygiene and, well, surprisingly advanced mechanical engineering.
I have to admit, looking at the photos from these boutique shops like Mama Bear Ladywear or Soak Green, these things look deceptively simple.
They do?
They're just tiny, leaf-shaped or petal-shaped reusable cloth pads. In fact, the brand Party in My Pants literally calls them pedal powers.
That's very on brand for them.
It is, right.
Yeah.
And they're made of soft materials like organic cotton flannel or a bamboo fleece, but they aren't worn like a traditional sanitary pad that sticks to your underwear.
No, the placement is completely different.
Yeah, the wearer folds the cloth pedal and tucks it directly between the labia.
Yeah.
And your body's natural anatomy simply holds it in place.
Which initially that placement sounds a bit precarious to anyone unfamiliar with it.
I would think it would just fall out.
Right, but the functional mechanics are highly strategic.
Because you have to think of it less like a sponge and more like a strategic gutter system.
A gutter system, I like that.
Yeah, like a tiny structural funnel for your body. Instead of menstrual fluid or discharge just going wherever gravity takes it, this little folded pedal actively directs the flow.
Right, right.
It forces the fluid to travel straight down into the center of a traditional sanitary pad or your period underwear.
Which optimizes the absorbency of whatever primary product you're using.
Exactly. It catches sudden gushes, and it actively prevents what the industry calls channeling.
Channeling.
Which is the worst. That's when, especially at night when you're lying down, blood runs backward between the buttocks and leaks off the back of the pad entirely.
Right, ruining the sheets.
Yes. Everyone who has experienced a period knows the dread of channeling.
Well, what's fascinating here is the sheer amount of physics required to make that structural funnel function without the wearer even noticing it's there.
Wait, there's physics involved in a piece of flannel.
Oh, absolutely. You might look at a piece of folded bamboo fleece and think it's a basic sewing project, but if we dive into the U.S. patent filings,
Okay.
specifically U.S. 205, 1375558A1, and the related filings, you realize it's this incredibly complex exercise in compression dynamics.
I was reading through those patents, and I was genuinely shocked by the testing methods. They are measuring things I didn't even know you could quantify for a $2 piece of cloth.
The precision is staggering. The patents detail measurements using something called a Kawabata evaluation system.
Kawabata. What is that?
It's this highly advanced machine used in textile engineering to measure exactly how fabrics bend, compress, shear, and stretch.
Wow.
Yeah, they didn't just guess at the materials, they mapped the biological landscape of the human body.
Which is a pretty uneven landscape to map, I'd imagine.
Very uneven.
Yeah.
So the term labia refers to both the outer lips, the labia majora, and the inner lips, the labia minora,
Right.
near the vestibular floor, which is essentially the top innermost area.
Yeah.
The labia minora are pushed tightly together by the larger labia majora outside them.
Got it.
And the Kawabata system found that the interlabial pressure near that vestibular floor is about 1.2 times higher than the pressure near the anterior ends, the front.
So it's not a uniform environment at all?
Not at all.
So if you just shove a uniform piece of cotton in there, I assume it simply fails under the uneven pressure.
It fails completely. The physics dictate that a pad with uniform thickness and density will just crumble
Oh.
because the higher pressure at the top will crush the pad, and that causes the front of the labia to gape open.
And once that structural integrity is lost,
The pad will literally just fall out when the wearer changes position, like standing up from a chair.
well, nobody wants a structural funnel that just abandons its post the second you stand up.
No, that defeats the whole purpose.
Right.
So to prevent that, the patents describe the necessity of engineering compression repulsive force into the pad.
Compression repulsive force. That sounds intense.
It does. But basically, the material in the highest pressure zone must be denser.
Okay.
Manufacturers achieve this by using multiple laminated layers of absorbent bodies, or varying the fiber densities so that the pad physically pushes back against the body's pressure.
Oh, I see.
And this keeps the left and right labia strictly parallel to each other. When they remain parallel, the pad stays locked in place, and the fluid is perfectly captured.
It is literal aerospace level material science applied to bamboo fleece.
It really is.
And while the science is high level, the practical everyday reality of using these is actually pretty funny to read about in the source material.
Oh, the user guides.
Yes. Because your body holds it in place so seamlessly, you kind of forget it's there. So brands like Mini Vivi and Amy pads have to explicitly remind users, when you fold it, make sure you leave a centimeter sticking out the front.
A very vital functional requirement when you consider bathroom logistics.
Right. Plop. Gone. Because when you sit on the toilet, the labia naturally relax. So if you don't have a little tab to grab, your highly engineered interlabial pad suddenly becomes an into-toilet pad.
Exactly.
They also strongly advise washing these tiny petals in a mesh laundry bag. Otherwise, they just vanish into the abyss of your washing machine filter, never to be seen again.
It's the sock monster, but worse.
Totally.
But, those practical warnings highlight how integrated these items become into a person's daily life.
Yeah.
But here's the thing. If a cloth pad just acts as a surface-level safety net to catch a leak, it leaves a massive problem unsolved.
What do you mean?
Well, you mentioned earlier that they are heavily marketed for light urinary incontinence too, not just periods.
Oh, right. Like the sneeze or laugh leaks.
Yes, but while a pad protects your clothing, it doesn't fix the underlying structural reality of why those leaks are happening in the first place, or why the tissue itself is changing.
And that is the crucial bridge to the medical side of our source stack. Because the marketing shows that this incontinence issue is incredibly common, particularly as women get older.
Right. And to understand the root of that commonality,
Yeah.
we have to look at the clinical sources regarding the biological shift that occurs as women enter perimenopause and menopause.
Okay.
It all comes down to dropping estrogen levels.
Which changes everything.
It really does. During a woman's fertile years, the vaginal and vulvar tissues are supplied with abundant estrogen. And this master hormone keeps the lining thick, hydrated, elastic, and filled with natural subcutaneous fat.
So it's plump and healthy.
Exactly. That fat allows the tissue to stretch and cushion the area naturally.
But here's where it gets really interesting, though. When menopause approaches and estrogen levels plummet, the tissue basically goes through withdrawal.
Clinically, it is referred to as vulvovaginal atrophy.
Atrophy.
Yes. At a cellular level, the tissues physically thin out. They lose their elasticity, their structural hydration, and that natural fat cushioning we just talked about.
Wow.
Even the pH of the environment changes, making the area much more susceptible to irritation.
So a $1.50 piece of highly engineered bamboo fleece is a fantastic tool for catching a sneeze leak resulting from these changes.
Sure.
But to actually rebuild that lost cushioning, women are having to turn away from textiles and look toward medical aesthetics, which leads us directly to the second part of our mission today.
The labial puff.
The labial puff, also known in clinical circles as labia majora rejuvenation or labial augmentation.
Right.
And I have to be completely honest here. When I first saw the term labial puff next to pamphlets for plastic surgery, my immediate reaction was just pure skepticism.
That's a very common reaction, actually.
Well, I read through the sources, and some of these clinics, I mean, we're looking at places in Miami, Beverly Hills, Washington, D.C., they mention achieving a quote-unquote Barbie appearance.
Uh-huh.
They talk about fixing asymmetry, and I just have to push back on this. Is this just extreme, medically unnecessary vanity? Are we really putting dermal fillers into intimate areas just to look like a doll?
I get where you're coming from. It is a completely valid reaction, and honestly, it's a debate the medical community itself has grappled with.
I would hope so.
But if we look closely at the clinical literature and the patient testimonials within these urology and gynecology sources, a much more complex picture emerges.
Okay.
For a subset of patients, sure, the motivation might be purely cosmetic. But for a vast majority, this procedure is deeply functional. It is about restoring a lost quality of life.
Because of that atrophy we were just mapping out earlier.
Exactly. It makes more sense when you actually map out the anatomy.
Walk me through it.
So the labia majora, the outer lips, they are structurally designed to act as a protective cushion for the labia minora, the inner lips, and the vaginal opening itself.
Okay.
When the labia majora lose their volume and deflate, they can no longer perform that mechanical job.
Right.
So the inner, highly sensitive tissues are suddenly left exposed to the outside world.
Oh, man. I hadn't thought about the sheer mechanical friction of that exposure.
It's intense.
Without the outer cushion, the inner tissues are just taking the brunt of every movement.
And it causes severe physical discomfort. Women report constant chafing against tight clothing, like leggings or exercise gear.
Ouch.
They experience pain while riding a bike or even just walking around normally.
That sounds miserable.
It is. It also leads to significant pain during sexual intercourse because that natural protective barrier is simply gone.
Wait, I recognize a specific detail from the sources regarding what else causes this deflation.
Oh,
That's tied to the rapid weight loss from GLP-1 drugs like Ozempic, isn't it?
yes, absolutely.
The medical aesthetic world has even coined the term Ozempic vulva.
Right, because the body doesn't discriminate when it burns extreme amounts of fat.
Yeah.
The labia majora are largely composed of adipose tissue, which is fat.
Okay.
So when a patient experiences rapid, significant weight loss from these GLP-1 medications, they don't just lose fat from their abdomen or their thighs.
Right, they lose it everywhere.
They lose it from the labia majora as well, which leads to this sudden and extreme deflation well before menopause might naturally cause it.
So, whether the loss was from menopause, childbirth, or medication, the labial puff is essentially rebuilding that lost cushion.
Precisely. It's structural repair.
But how exactly are they doing it? Because, frankly, the idea of needles in that particular area sounds incredibly intense.
It sounds daunting, but the procedure itself is surprisingly straightforward. It usually takes only about 30 minutes in an outpatient setting.
Just 30 minutes.
Yeah, and there is no general anesthesia required.
Oh, wow.
Physicians apply a strong, topical numbing cream to the outer labia to manage the comfort. And then, using a very fine cannula, they inject a volume-restoring substance.
And it's fascinating that they're using hyaluronic acid here.
Yes.
We usually hear about that for, cheek and lip fillers on the face, but using it in this intimate context makes total sense mechanically. The women's clinic in Glasgow specifically mentions using an organic hyaluronic filler called Novia Rose.
Right, Novia Rose. It leverages the exact same chemical properties that make it popular in facial aesthetics.
Because it holds water.
Exactly. Hyaluronic acid naturally attracts and holds water. So not only does it instantly restore the physical volume and the protective cushion to the labia majora,
Right.
but it deeply hydrates the mucosa from the inside out.
That is so smart.
And furthermore, the physical presence of the filler actually stimulates the body's fibroblasts.
Wait, fibroblasts?
Yeah, they are the specific cells responsible for creating new natural collagen in the area.
So it's fixing the mechanical friction issue, stopping the chafing, reducing the pain during intimacy, and actually improving the skin quality over time by triggering the body's own collagen production.
That's exactly right.
Okay, that makes the vanity argument seem pretty shallow.
Right.
For women dealing with severe atrophy, this is functional reconstructive work.
It is.
What does the recovery look like?
Well, that functionality is the main appeal over traditional surgery.
Like a labiaplasty.
Exactly. With a surgical labiaplasty, where they physically cut and remove tissue, the recovery can be brutal.
I can imagine.
But with a puff, There is virtually no downtime.
Really?
Yeah, patients might experience some mild swelling or bruising, but they can generally resume normal daily activities and even sexual intercourse within 24 to 48 hours.
That is incredible. And the cost. I imagine this isn't covered by insurance if it's coded as cosmetic, even if the patient's primary motivation is functional pain relief.
Unfortunately, you're right. It
Yeah.
is almost entirely an out-of-pocket elective expense.
Okay.
Depending on the clinic's location and the materials used, it typically ranges from $1,500 to $3,500 per session.
Wow, that's not cheap.
No, it's an investment. And it is important to note that the hyaluronic acid filler is not permanent.
Right, your body breaks it down.
Exactly. The body eventually metabolizes it, so results typically last between 6 to 12 months before a touch-up is needed.
Oh, okay. So it's an ongoing thing.
Usually, yes. Now, there is an alternative, which is using liposuction to transfer a patient's own fat.
Oh, like a fat graft.
Right.
Oh.
And that can last years, but the initial procedure is much more involved and significantly more expensive.
So what does this all mean? We started this deep dive looking at a reusable cloth leaf that you fold up to stop period leaks using compression repulsive force.
Yes?
And we've ended up discussing injecting hyaluronic acid to reconstruct a deflated tissue and trigger fibroblast production.
Quite a journey.
On the surface, they seem worlds apart.
But if we connect this to the bigger picture, both of these innovations represent a massive structural shift in women's healthcare and intimate wellness.
Yeah.
We are finally moving away from the era of silent suffering.
It really is the absolute end of the one-size-fits-all approach to the female body.
Exactly.
If you are someone who just wants to comfortably make it through a heavy period without ruining your sheets, or you want a structural safety net for a sneeze leak while you're at the gym, you can spend a few dollars on a brilliantly engineered reusable cloth pad.
You have an accessible, physics-backed tool right there.
Right? And if you are suffering from severe friction burns from your clothing because of postpartum tissue changes, or you are experiencing painful intimacy due to menopausal atrophy, you are no longer told to just, deal with it.
No.
You now have access to a 30-minute medical procedure that can instantly restore your anatomy's natural protective function.
It is entirely about the power of knowing your options.
Yes.
Whether you are prepping for menopause, dealing with the aftermath of rapid weight loss, or you just love understanding niche, highly specialized human innovations.
Like we do.
Like we do. The takeaway here is agency.
Agency.
You don't have to just accept discomfort. The tools exist from the laundry room to the clinic.
That's a great way to frame it.
But, this raises an important question, though.
Oh.
And it actually points back to one of the most fascinating yet easily overlooked documents in our entire stack of sources.
Wait, which document is that?
It is an older patent, US 600-00749AA, filed by an inventor named Hirschman.
Hirschman. I remember seeing that name.
Yeah. While modern interlabial pads are heavily marketed for comfort and leak protection, this patent describes using the exact same physical concept.
A small absorbent pad placed between the labia.
Right, but specifically constructed out of rayon fiber.
Rayon. Why use rayon specifically?
Because rayon has incredible hydrodynamic properties for collecting exfoliated vaginal cells and fluids.
Waves.
Yeah. The patent wasn't designed for catching menstrual blood. It was designed as a fluid collection apparatus for diagnostic purposes.
So instead of going to a clinic for a painful, invasive swab or a scrape?
The pad itself does the collection.
That is wild.
The patent notes that the pad is non-invasive, securely retained by the body, using those exact same compression dynamics we discussed earlier.
Right, the Kawabata physics stuff.
Exactly. And it's perfectly positioned to collect cellular samples naturally shed by the body over just a few hours.
That is mind-blowing.
Isn't it?
If women are already becoming so comfortable wearing these tiny folded cloth petals purely for hygiene and leak control, could the future of these simple cloth pads actually be life-saving at-home diagnostic testing?
It's a very real possibility.
Could you just wear a specialized rayon petal for a few hours, pop it in a biohazard tube instead of a mesh laundry bag, mail it off, and detect early signs of disease?
It takes a simple comfort item and potentially turns it into a revolutionary, non-invasive medical device.
Wow.
It really shows how much untapped potential there still is in understanding and optimizing female anatomy.
From bamboo fleece acting as a structural funnel, to hyaluronic acid restoring the literal foundation of the body,
Hmm.
to rayon fibers potentially diagnosing illness.
It's
We
incredible.
really have moved way past the era of one-size-fits-all healthcare. It turns out some of the most profound, life-altering innovations aren't happening in sterile labs or spaceships. They're happening right inside our own clothing. Keep questioning, keep exploring, and we'll see you on the next deep dive.